Today, we're going to discuss the top 10 foods that can help heal the kidneys. Before diving into specifics, it's crucial to address a common misunderstanding: there isn't a single kidney diet. Recommendations vary significantly depending on the stage of kidney disease. The standard kidney diet focuses on limiting certain nutrients to reduce toxin buildup in advanced cases. However, healing and restoring kidney function require an entirely different approach. Kidney disease is classified into 5 stages based on the estimated glomerular filtration rate, eGFR, and creatinine levels. The kidneys filter hundreds of liters of water daily, removing substances like sodium, glucose, and creatinine. While glucose and sodium are reabsorbed into the body, creatinine is not. Elevated creatinine indicates impaired kidney filtration. Here's how the stages break down. Stage 1, eGFR greater than or equal to 90, indicates normal filtration but other potential issues, such as protein in the urine. Stage 2, eGFR 60 to 89, often appears normal in blood tests but may reflect early kidney damage. Stage 3A, eGFR 45 to 59, signals mild to moderate decline in function, while Stage 3B, eGFR 30 to 44, indicates more significant damage. Stage 4, eGFR 15 to 29, represents severe impairment, requiring stricter management to delay progression. Stage 5, eGFR less than 15, is end-stage renal disease, ESRD, often requiring dialysis or a transplant. Approximately 15% of the global population has some form of kidney disease, with less than 1% in Stage 5. Stages 4 and 5 combined represent about 3% of cases, while Stages 1-3A account for the majority. The standard kidney diet, which emphasizes nutrient restrictions, applies mainly to severe cases, Stages 4 and 5. For individuals in earlier stages, the focus should be on addressing root causes to slow progression or even reverse damage. For Stage 5 patients, limiting sodium, potassium, phosphorus, nitrogen, from protein, and even water is critical. These restrictions aim to manage symptoms and prevent complications, but do not heal the kidneys. It's a mistake to assume that avoiding these substances prevents kidney disease. In fact, nutrients like protein and minerals are essential for overall health and kidney recovery in early stages. Let's evaluate some foods often recommended for kidney health to determine their actual benefits. Red grapes. These are touted for their antioxidants and anti-inflammatory properties. While this might benefit general health, it's less relevant to kidney healing. Red grapes are low in phosphorus, potassium, and sodium, which is favorable. However, their high sugar content makes them unsuitable, especially for individuals with insulin resistance or diabetes, the leading cause of kidney disease. Verdict: not recommended for a kidney diet. Causes of kidney disease. To understand what foods to include or avoid, we must consider the primary causes of kidney disease. The biggest contributor is type 2 diabetes, which accounts for the majority of cases. This is followed by hypertension, often linked to insulin resistance. Other causes include kidney infections, overuse of medications like NSAIDs, autoimmune diseases such as lupus, which attacks soft tissues, including the kidneys, and exposure to toxins like heavy metals, pesticides, or environmental chemicals. Addressing insulin resistance is critical, as it can prevent or mitigate most kidney disease cases by managing both diabetes and hypertension. Apples, often recommended for their fiber, antioxidants, and vitamin C, apples are low in sodium, potassium, and phosphorus, making them safe for most kidney stages. However, their sugar content requires moderation, particularly for those with diabetes. Verdict: moderately beneficial but not a standout food for healing. Healing the kidneys involves a targeted approach based on the disease stage. For early stages, the focus should be on addressing root causes such as insulin resistance, managing blood pressure, and preventing infections. For later stages, strict dietary restrictions are necessary to avoid worsening the condition. While some foods may have general health benefits, they might not always align with kidney health goals, especially when sugar or other harmful components are involved. Onions are praised for adding flavor without excessive potassium. When consumed in reasonable quantities, their potassium content isn't a concern, and they're low in sugar. Unless someone eats an unusually large amount, such as in an onion soup, onions are a safe choice. This earns them a checkmark for kidney health. Cauliflower is often recommended as a low-potassium, high-vitamin C food. However, with 299 milligrams of potassium per serving, it's not truly low in potassium. Cauliflower is nutrient-dense and low-carb, making it suitable for a keto diet, but the amount consumed matters. For individuals in kidney disease stages 3B, 4, or 5, eating large quantities, e.g., cauliflower mash, can lead to potassium levels exceeding daily limits, potentially causing serious issues like slowed heart function. For stages 3A and earlier, where potassium restrictions are less critical, cauliflower is generally fine. Garlic is celebrated for its anti-inflammatory and antioxidant properties. While it has relatively high potassium levels, the amount typically consumed, whether a few cloves or even a whole bulb, is minimal, making potassium intake negligible. Garlic is a beneficial food for most people and earns a checkmark. Similarly, ginger shares many of the same properties and benefits without significant concerns when consumed in moderation. Cabbage is low in phosphorus, potassium, and sodium, making it a safe option for kidney health. Although it contains phytochemicals with anti-inflammatory properties, its role in kidney healing is limited. It's safe to consume in typical amounts, but an extreme diet like a cabbage soup-only regimen could cause imbalances. Overall, cabbage is a safe choice. Cherries are rich in antioxidants and anti-inflammatory compounds, but their high sugar content makes them less ideal for individuals addressing insulin resistance. While low in phosphorus and moderately low in potassium, cherries don't align with the goals of reversing insulin resistance and kidney disease. Bell peppers are touted for their vitamin A and C content. Potassium levels vary slightly between red and green peppers, with green being a better choice for those needing strict potassium control. Consuming a few slices is unlikely to pose issues, but large portions in dishes like stir-fries may contribute more potassium than desired. This earns bell peppers a question mark, depending on quantity consumed. Berries, including blueberries, raspberries, and strawberries, are generally low in phosphorus, potassium, and sugar, making them a good choice for a low-carb or ketogenic diet. They can be consumed in moderation as a healthy addition, earning them a checkmark. However, excessive consumption, such as overeating during a berry picking session, could lead to higher sugar and potassium intake. Egg whites are low in phosphorus and often recommended as a high-quality protein source. However, consuming egg whites alone isn't ideal for nutrition because the yolk contains essential nutrients and proteins that complement the white. For those with advanced kidney disease requiring phosphorus restrictions, stages 4 and 5, egg whites alone are appropriate. For others, eating whole eggs provides better overall nutrition, though large quantities could push phosphorus levels too high. Egg whites receive a question mark depending on dietary needs. Olive oil, particularly extra virgin and organic varieties, is an excellent source of heart-healthy monounsaturated fats. Its phosphorus, potassium, and sodium levels are negligible, making it safe for all kidney stages. While often regarded as a plant oil, olive oil contains 16% saturated fats and 74% monounsaturated fats, underscoring its value as a healthy fat source. It earns a checkmark for kidney health. Understanding the nutrient content and metabolic impact of foods is crucial for kidney health. While some foods are safe or even beneficial for general health, they may not align with the goals of reversing kidney disease or insulin resistance. Tailoring food choices to individual health conditions and kidney disease stages is essential for achieving the best outcomes.